In health news tonight, it doesn't happen often, but when a trauma case arrives at BC Children's Hospital, doctors and nurses have to be on top of their game, working fast and under incredible pressure to save young lives. Maintaining those skills is truly a matter of life and death, and that's where a unique program at BC Children's Hospital comes in.
So, Dr. Dimitrician, can I get you to assess the airway?
No, I can see the vocal cords.
Let's give him 20 milligrams of ketamine, and you can follow that up immediately with 20 milligrams of rocuronium.
A 4-year-old boy hit by a car gets rushed to emergency.
That will go into his lungs, but that will help us to breathe for him.
Intensive care doctor Mona Singhal and her trauma team jump into action.
Roll him back onto his back on your count.
It could be the kind of emergency scenario doctors and nurses at BC Children's Hospital specifically trained for. And in this case, it is training. The little boy is actually a high-tech mannequin, and this room is part of the brand new Pediatric Simulation Centre.
We know that simulation is a way of making teams work a lot more effectively, and so we don't have to learn on real patients, we can learn on our simulated patients, and that way when we come to this kind of setting where there really is a 4-year-old boy in the bed, we know that he's going to get better care.
I'm going to use this one.
Just like William Grindle. In late September, the little boy and his family were out for a walk near their home in Lions Bay. He tripped and fell, landing on his neck right on top of a stick. Though it didn't puncture his skin, it actually tore his windpipe.
It was awful, dreadful. Just screaming for help. You just don't, and you don't know how you're coping, and you don't know, and you've got a little toddler on the side of a road, another boy you're looking after, holding on to a dog so he doesn't run off. And meanwhile, your boy's on the side of the road, and you think he's going to die.
William ended up in the trauma room at BC Children's. The medical team stabilized him and his windpipe healed within days. For Dr. Bennett, it's the perfect example of how practice makes perfect. And with the latest technology, the training scenarios are so realistic. The interactive mannequins range in size from newborn to teenager. They can be programmed on the fly from a control center so they can get better or worse depending on the doctors and nurses' actions.
Absolutely, people start to buy into it, and you'll see people starting to get more engaged. On the debrief, I've had people burst into tears if things haven't gone well or they thought they've done something wrong. People get very, very invested in what they're doing with that mannequin because they can really put aside their disbelief and work as if it's a real patient.
So there's a lot of sound pollution in this room.
Medical simulation is a growing field that has dramatically changed training for healthcare providers. There are now 4 centers around the province. The pediatric program was funded by donations from the mining industry, and there are plans to expand. The mannequins will be used to assess patient flow in the new children's hospital and to help train parents who have to go home with children who have medical needs.
We see it going on the road, so going out to rural areas, bringing a mannequin into an emergency room in a rural area, particularly in pediatrics where they don't do very many of these patients, and running scenarios so that the team out there can identify what they need to do. I think the scope is huge.
William doesn't remember anything from his accident, but his mother can't forget. She is just so thankful the trauma team was ready to save her son's life.
It's a memory that has made me realise just how precious life is and how precious my son is, and I'm embracing every minute of it now.